to use supplements. There are other certain conditions that also present like dementia as well. And, having a urine infection, feeling poorly, having pain or chest infection can all give symptoms of dementia. Having low iron, and as I said before, the vitamin B and D deficiencies. And these are all treatable and they can all impact cognitive functioning. So if you have memory loss or you're experiencing cognitive impairment, it's really important to get that checked out because it can be something that can be treated. So in this little section here, we take a look at how dementia affects different parts of the brain. I always find it useful to share this in our level 1 and level 2 training because it gives us a little bit of insight into how a person with dementia may present and why. So at B&M Care, we advocate and use the person-centered model of care. And we don't place too much of an emphasis on the clinical element of the model or the clinical element of the disease. However, it's really important that we know how dementia affects the brain because it also gives us insight into how to appropriately care for people with dementia. So the brain has 4 lobes of the cortex and they all do different things and dementia affects them differently. So with the frontal lobe, that sits behind the eyes and that controls our emotions, what we say and what we do. It also affects the planning and executive functioning, which we spoke about earlier. And then the temporal lobe, which is at the side of your ears, is a part of the brain that is all about knowledge and understanding, memory, language, and communication. It also controls inhibition and mood. So if this part of the brain is damaged, it can increase mood swings and disinhibition, which is where we could see an increase in things such as sexualized behaviors. And then we have the parietal lobe. Now, if this is damaged, it affects the way in which we process and plan. It also affects the way in which we move about. So it increases poor spatial awareness. It reduces bodily awareness, dexterity, and motor skills as well. So with this part of the brain, if that's damaged, it can also affect someone's mobility and increase the risk of falls. It can also impact diet because if the dexterity and the movement of the hand is affected, they may not be able to hold a normal knife and fork. In addition to that, the way they move around the room can also increase the risk of falls. We then have the occipital lobe, which is all about visual perceptions. Now, if the occipital lobe is damaged by dementia, it will impact the world around the person. It also, the occipital lobe supports us in helping to identify what's coming through the eyes. And if there's damage, it will impact what the person with dementia will see. So for example, sorry, just been close to the mic. Yeah, so for example, it will impact you if there is shapes, geometric shapes, if there's certain colors and lines, which is why it's important to consider the environment. So even if you're caring for people at home, you need to be mindful of the environment, your front rooms, your bedrooms, your kitchens, because it also impacts people with dementia in many, many ways. And at B&M Care, we have our own guide called Wellbeing by Design, and we've developed that based on research and best practice to ensure that people are living well in our care homes and the environments are based on research. So in this slide, we look at notable behaviours and how they may present in dementia. And this is now thinking about the psychological and social elements of person-centred care. A loved one with dementia may exhibit challenging behaviours. Now, we don't refer to challenging behaviours as such. We call them behaviours of distress or forms of communication or unmet needs. People with dementia may exhibit these behaviours because they are trying to tell you something. They are trying to communicate how they feel and they're trying to express a feeling. Most behaviours of distress may appear to be challenging, but also what we need to look at, we need to see them as an unmet need. When a person with dementia feels disempowered or losing control, they will try to take back control of their lives. They may be new to a care home. They may show a behaviour such as hoarding or refusing to bathe or wash or refusing to take their meals. This is so they can retain a sense of control and autonomy over their lives. They need to feel in control of their lives, keeping hold of their dignity and sense of self. So telling you no empowers them. We also see a lack of focus. They cannot sit still, walking with purpose, pacing and wandering. These are all negative behaviours of distress. In addition to that, we don't know the reason why they are doing that. It could be because they are hungry. It could be because they are thirsty. It could be because they're in pain. There's always a reason for the way in which a resident exhibits themselves. There's also the loss of peripheral vision, and if we don't communicate face on, we could end up with a high startled response, which could lead to a person maybe hitting out or shouting or being angry. We've brought about that behaviour through our actions, so it's very, very important to focus on how you communicate. We often see in dementia that people sometimes don't recognise loved ones, and this is called facial agnosia. And this is often reported in Alzheimer's, and it's often attributed to memory impairment. So that can be very, very hard for family members to have spent, many years with their husband or their wives, their sons, their daughters, for them not to recognise you anymore. So we do an awful lot of work with families to try and support you through that part of your journey. In addition to that, there is an increased risk in shadowing, and that's following loved ones around, which can be very, very hard for you as, as partners, loved ones, because you feel like your space is invaded and you never get a moment to yourself. Now, this is largely due to your person with dementia feeling scared or vulnerable. So they may follow you around, and this is called shadowing. In addition to that, there are other reasons why we see behaviours of distress. Pain and discomfort that is undetected is a big cause and a big problem in changes of behaviour. Pain is one of the most common symptoms that people with dementia experience. However, it's often poorly recognised and untreated in dementia. The main reason for this is that dementia progresses, your loved one's ability to communicate pain becomes more and more difficult, which is why we need to treat pain appropriately and recognise the signs for pain. Poor health can also contribute to behaviours in dementia. And this could be as a result of an infection, such as a urine infection. It could be to do with a chest infection, a sore toe, sore dentures. And if a loved one has sudden or unexplained changes in their behaviour, or an increase in confusion or agitation or apathy, it could be because they are in pain or they have a UTI or chest infection, for example. So there are lots and lots of other reasons why people would exhibit behaviours. In addition to that, low mood and depression, as well as having negative feelings, if a person with dementia has depression, it can make everything seem so much worse. In addition to that, it can also make their memory worse. Depression may almost be a sign that they're having their diagnosis, they're losing control around them, and they're depressed because of that. And it could not, it might not be just because of the dementia. Then we have side effects of medication. Now, we don't readily advocate or use antipsychotic drugs at B&M Care. We've got lots of protocols and we do work within the NICE guidelines because they can cause very serious side effects like daytime sleeping, drowsiness, and confusion. They also increase the risk of falls. So we always work within a framework that promotes person-centered care. Lack of life history, our lives shape who we are, and it can really help people with dementia to share their stories to enhance their sense of identity. This is especially useful when having difficulty in sharing information about themselves. So life work is really, really important, especially in care homes. And we do have our own life history tool that we are rolling out to complete for each and every single resident. And life work helps encourage better communication, and it really helps us to understand the individual. What made them? Were they a professional? Were they a housewife? Did they work out in the fields all day? Were they a runner? All of this is shaped who they are. And then we may see these traits and personalities in their dementia. So it's really, really important that we have their life histories to help build their care plan. So as I spoke about earlier on, one thing we've really focused on is the environment, and an over or under stimulating environment really affects the person with dementia. They can be extremely sensitive to their environment. So it's better to have general moderate levels of stimulation rather than heightened or low levels. Because if they are overstimulated, this will increase confusion and agitation, whereas too little stimulation may cause them to withdraw from the world, apathetic, sitting, sleeping a lot. So it's better to have activities and occupation that resonate with them, that will encourage them to have well-being in their lives. There are many different things we can do to support your loved one living with dementia, and we have a few tips to support you at home. Now, we often say don't confront and correct the person with dementia. It's very, very hard for you as carers because, some of you are, the only person in your loved one's lives. And if they're still living at home with you, that's easier said than done when you have a repetitive loop of certain questions. However, we use a technique called validation technique. So, for example, if somebody's asking for their mum, don't confront them and say, why do you want mum? Mum died in 1940, for example, because then you're going to create a wealth of emotion around that because they don't remember that. So instead, you have to validate what people say, and you could turn around and say, "Oh, mum, yes, she looked like you," or "Mum had the lovely brown eyes like you." And that way you are acknowledging that they're talking about mum, but also you're steering away from any negative response. In addition, with a big cliche that we use in our sector called climbing their bubble, and that really is about going with their reality. The world around them is very, very real to them, and we don't know what the brain does, and it does, wonderful things, and it can really distort the vision and the world around them. There's a guy that we work quite closely with in the sector called Norman McNamara, and he is living with Lewy body dementia, and he is more than happy for me to share his story. He's in his late 50s now, and he founded the Purple Angel charity, and he does travel the world or even the country, sort of advocating for people with dementia. He had recently done a program up in Bolton, and he was travelling back down to Newton Abbot in Devon, and the whole of his surroundings changed, and he went back to being in Bolton, although he was on the dual carriageway in Newton Abbot. And he said it was like a scene from a stage. The curtain had come down, the whole environment morphed into something else. And then after about half an hour, he came out of it and he couldn't remember where he was. Now, he's able to share this powerful, powerful story to give us some insight into what happens. So for him, he was back in Bolton, and that is his reality. And we often see that in people with dementia where they want to go home, they want to, they've got to get home for the children, or there may be children in the cupboard, or there may be children out in the garden. And we often see that with hallucinations. That is their reality, and we have to jump into their bubble. We have to jump into that reality because until they're out of it, it is really, really real with them. One thing that's really important is to take time for yourself. We cannot and never should forget the carers, and you are as, if not more important. This is your journey. You are underpinning your loved ones, you are supporting them through this, and it really matters that you are also looked after and nurtured and loved and cared for. So we would always say, join a group if you can and utilize your local care homes. And there's lots and lots of dementia support groups out there for you. The care home is the hub in the community, and at B&M Care, and I think all providers should really have some sense of responsibility to support people in the community. And we often do little dementia cafes and coffee mornings, so it's a good place for you to come and offload. What we also find in dementia is that we need to establish very clear routines with our loved ones. And we often find that having a consistent time frames for meals, activities, and good sleep hygiene, good bedtime habits really support families as well. Incorporate familiar activities. If it was their job to do the dishwasher, encourage him to still do that. If he was the gardener or the taken out of the bins and that's what they used to do, try and encourage them to do that. Even it may take them longer or they may get it wrong. It gives them a sense of purpose, and also it resonates with their past and who they are. In addition to that, we speak about, psychological needs. It also supports their psychological well-being. I think as well, avoid sudden changes, things that are out of the ordinary that can lead to confusion and anxiety. That can also bring about behaviours of distress. Communication is very, very powerful, and we spoke about the peripheral vision. Communicate clearly and slowly. And we often say to our carers, don't overload, don't give too much instructions because it will become too much for them to take in, and that can become challenging as well. So we often think about communicating face on, nice open posture, welcoming, lots of smiles, and it really does go a long, long way. There are lots of practical things as well that you can do in your at home to support with dementia, and that's a lot around colour contrast. Now, what we've found based on research is that having things like a red cup or a yellow plate, for example, can really support people with eating and drinking. That's because as we age, we lose the ability to differentiate colour. In addition to that, with the way that dementia affects the occipital lobe or your brain, we sometimes are unable to see lighter colours. So your pales, your insipid colours, your pale pinks and your pale blues. So having a bright primary colour will often support at meal times. And then we spoke about having adapted cutlery that can also help as well. And there's little things at home where you have lights, you can have the light surround in a different colour, your taps, your grab rails at home in a different colour. These can all aid independence. As well, thinking about the environment, moving away from geometric shapes and patterns, which can distort vision. Black mats will be seen as holes, and mirrors can also bring about fearful feelings because they may not recognise the person that they're looking at in the mirror. So we try to reduce having mirrors in our dementia communities. In addition to that, TV and radio on loud or at the same time is absolute sensory overload. So have one thing on that they like and then, reduce the other. So not on together. We speak a lot about in our care homes about lack of appetite. So having smaller portions over the course of the day, grazing foods, foods that can be picked up, fortified shakes and smoothies all help as well. Lollies and drinks, for example, that are made with, lots of lovely fruits also help. So there are little things that you can do to support that go a long way to helping you and your loved one. So in 2018, we developed our own model of care, which is underpinned by the person-centered model of care. And I don't know if any of you have heard of that, but it is attributed to Professor Tom Kitwood at Bradford University. So we've used our rose emblem and developed 7 elements of our model. And we use this to try and ensure that we're incorporating these into our residents' daily lives. So we see that if you're respecting individuality, you help and support people because they are different and everyone is different. No dementia journey is the same. And if you've met one person with dementia, you've met one person with dementia. Everyone will experience their journey differently. So we try to build personalised care plans that incorporate their individuality. In addition to that, we adhere to legislation such as the Mental Capacity Act and advocation to empower people with dementia to have a voice. And we do that through these webinars, seminars, cafes, meetings. You see all our posts on social media. It really is about empowerment. And we want people in our care to be able to live a life where they can take a risk and they can have fulfilling lives, showing compassion and having meaningful engagement. We want people in our care to be connected to their world around them, connected to their loved ones, and connected to their community. And if we incorporate all these different elements, they will surely flourish. And that brings about well-being in dementia. To measure the well-being and engagement of residents, we also use dementia mapping. Again, this was founded by Professor late Tom Kitwood. And we use this observational tool to look at the quality of life and engagement of the residents in our care. This is our model of care, and even if care is delivered in your own home, it should be person-centred. If you have care packages at home, you have these provided to you from somebody, an organisation that is regulated by the CQC. So they also have an obligation to be person-centred and to build care plans with you. So thank you for listening to the webinar. I'm now going to hand you over to Angela, who will conclude the final slides.
Thank you very much, Caroline. Lots and lots of information there. I just want to talk to you quickly just about how we can support, as Caroline said, at B&M Care, we see it as our obligation to support the communities in which where we operate care homes. We do things like memory cafes, and you'll find other providers doing that sort of thing as well. You could look at your care home as a place to come to for advice, for networking with other people in the same situations as you, for signposting. More importantly, they're a good resource for respite and short stay breaks as well. We do other webinars and pieces of training that we offer out to the public as well. There's a care funding webinar, our virtual dementia tour experiences, and our level 1 dementia training for all. So, don't be a stranger. Caroline, if you move on, perfect, thank you. She's moved on to the next slide. The virtual dementia tour is something I wanted to talk to you about, really, because you've accessed this piece of webinar training today, but you'll find the virtual dementia tour a whole nother experience. It's an interactive training experience. It's in person, so it isn't virtual. You have to be there. It takes a couple of hours, all in all. We deliver this training to all of our staff, and we open it up to our families and our relatives and the public. It really will give you an unprecedented insight and understanding into the world of dementia and a sense of what it might be like to live with dementia. Caroline, on the next slide, there are some dates. with the next events coming up. There is one on the 21st of March. These are the 4 locations we're running the virtual dementia tour at this year. You can hook back onto our website to book onto that. The other piece of training that you might find interesting is this year we are going to run the level 1 dementia awareness training. Caroline, that's on the next slide, please. It's like having Chris Whitty, isn't it, at your fingertips?
No, you're there. It might be a delay then.
The dementia awareness training in 2025. We've been very lucky. Advantage Training has given us permission to deliver this training to our staff. It's mandatory for all of our care staff in our homes to have this piece of training. It's 2.5 hours long. We can offer it to you free of charge. It's delivered by B&M Care's Head of Training, Elaine Thorpe. The objectives here are really just to move on from what we've done today: understanding of dementia, the risk factors, the theory around person-centered care. We talk about the pathway to diagnosis, the role of medication, and appropriate communication for people living with dementia. And we touch also on those complex perspectives, which Caroline's covered today. And then how we evaluate and measure dementia care. So the next slide, Caroline, will show us the dates. There's dates on this piece of training. It will take place at our very lovely training centre, which is based in Berkhamsted at one of our care homes, Ashlands. So you can access and book onto those events going back to gmcare.co.uk/events. Okay, really just to summarise today then, you can see it's our passion. We're very good at delivering care. So come and spend some time with us at one of our community events. If you haven't accessed care at one of our homes, come and take a look. Come and see what good dementia care looks like. Sign up for the level 1 dementia awareness training or the virtual dementia tour. Next slide, Caroline.
Yep.
Really just to summarise everything off today, I've given you some contact details here for us. I've got Caroline's email address, my email address, and you can take a look at our socials if you're not already taking part in that. If we can unshare that PowerPoint now, Caroline, and I'll turn my camera back on.
Yes, me too.
So you can see our faces. Lovely. Thank you very much for attending. We'll send you an evaluation form. I have been recording, but I think the first part of the recording might have been missed. We'll do our best and we'll learn as we go along. So we'll send you an evaluation form on email today with the recording as well. Thank you very much for your attention, and we will sign off now. Thank you. It's goodbye from me, and it's goodbye from her.
Bye.
We did rehearse that. Bye-bye. Thanks very much.
Bye.